Good afternoon, Dr. Berger.
Good afternoon, Irina.
There is a concern that GLP-1s are relatively new, perception that they're relatively new, and they can be harmful in the long run. What are your thoughts about it?
So the class of GLP-1 receptor agonist medicines is actually somewhat large, and the older medications like liraglutide, which is Victoza or Saxenda, has actually been on the market since 2010. Ozempic, semaglutide, has been on the market since 2017. Mounjaro, which is tirzepatide, also known as Zepbound for weight loss, is the newest of this group. It's a dual agonist medication, GLP-1 and GIP. It's been out about 3 years. However, these medications have a really good safety track record. Because they slow down gastric emptying, they can cause constipation, some gastrointestinal issues, but we try to ameliorate that with starting on a very low dose, lots of hydration, fiber in the diet, supplemental fiber, etc. And rarely these medications can cause pancreatitis. They are first and foremost diabetes medicines. We call them incretins. They increase the amount of insulin that the pancreas is able to produce. But this is pretty uncommon. It's not a life-threatening thing. It's painful. You need to get IV fluids in order to calm it down. But it's not exceedingly common, especially if you use the FDA-approved medicines, the compounded medicines. Sometimes people take much more than they think they're taking. They're not formulated right, etc. And most of the episodes of pancreatitis seem to occur from the compounded medications. The concern about them causing thyroid cancer. So in the very early studies of semaglutide in rodents, not in people, there was a small uptick in a rare form of thyroid cancer called medullary thyroid cancer. There has never been any association seen between the medications and thyroid cancer in people. And I always ask my patients about any family history of thyroid cancer or a cancer syndrome called MEN that can include thyroid cancer, as well as history of pancreatitis. But in terms of cancer, we know that obesity is, there are 13 cancers associated with obesity, among them breast, ovarian, uterine, thyroid, and colon, kidney, liver, and several others. So, and the incidence of these cancers is increasing as the rate of obesity has increased in this country. So controlling really excess fat mass, and not just weight, is really important to reduce cancer risk, as well as high blood pressure, high cholesterol, diabetes, sleep apnea, for which Zepbound is now FDA approved, and even osteoarthritis in the joints, because the arthritis of knees and hips in people who have excess fat mass is not just due to the weight on the joint, but because excess fat, it produces cytokines that are inflammatory chemicals that cause inflammation. And this actually erodes the cartilage as well. So many reasons to control weight, and these medicines can be a very good tool in the toolbox. At least 2 of them have been around, and more actually, have been around for quite a long time. Medicines are very well tested in clinical trials. And each of the medicines is something of a relative of the ones that have come before that have a long track record of safety. Now, of course, all medications can have side effects, and all medications can have rare things that happen. However, we know that excess fat mass causes so many different kinds of physiologic problems. And it's all depending on the patient and the individual, but they can be a very useful tool in our toolbox, in addition to all of the lifestyle that we focus on here in our practice. So as always, everything I offer here on these videos is for educational purposes only. No doctor-patient relationship has been formed. If you have particular concerns about your health, please don't hesitate to reach out to your medical professionals for their advice. But if you'd like to reach us, we are Northeast Medical Practice. We're located in Great Neck, New York on Long Island. We're a concierge-style internal medicine, weight management, as well as aesthetics practice. If you'd like to call the office, 516-604-3418 or northeastmedicalpractice.com. We'd love a chance to chat with you if you have questions and see how we might be able to help you. But until then, be in good health.